We initially proposed then a guideline that was based on the opioid use the day before surgery. If people didn't take any opioid pills the day before discharge, we recommended they be discharged with none. If they took 1 to 3 pills, we recommended discharge with 15 pills. And then if they took 4 or more, we recommended they be discharged with 30 pills. And that was designed to satisfy about 85% of patients' opioid needs. And so we designed this study to actually prospectively put that guideline in place and validate it. And what we found in this study was that, in fact, 93% of patients had their postoperative opioid needs satisfied with our guideline. In our initial study, we just looked at general surgery patients. In this more recent study now, we combined general surgery patients, patients with colorectal surgery, patients with gynecologic surgery, thoracic surgery, urologic surgery. We really looked at patients who are undergoing surgery from a wide variety of disciplines, and this held true for all these different operations. I think that our results are really very generalizable to the population that's having inpatient surgery for whatever reason. The surgeon plays a critical role in managing expectations. The first thing is that patients might be expecting to go home with opioid prescriptions. Having now done this study, or if someone reads this study, they can say to the patient, listen, we've studied this, we've looked at this, we've figured out how many opioids you need. And in fact, if you haven't taken any opioids as an inpatient, then you're not going to need any opioids at home, or the chances that you're going to need any opioids at home is very, very low. I think it's very important that surgeons set the expectation that that the patients will use other non-opioid analgesics like Tylenol and ibuprofen. So one of the key features of our study is that we prescribed Tylenol and ibuprofen or another non-steroidal to patients when they were discharged. And that sets the expectation that they should use it. It's a big difference if you prescribe it compared to just recommending that a patient take their home pills they might have at home beforehand. In this study, 95% of the patients took either Tylenol or ibuprofen, and 70% took both. Whereas in previous studies where we had just recommended they use it, we got about 85% taking one or the other, but only 20% taking both. And so I think that's another key piece in the expectation category. It's an important issue because 60% of our patients had some leftover pills, and only about half of the pills that we initially prescribed were actually used. So there are a lot of pills then that patients have in excess. And we worry about this is because those pills could be used by that individual patient and might predispose toward long-term or chronic opioid use. But those excess pills can also be diverted to others and perpetuate opioid misuse in the community. This is a really important issue, and previous studies had relied on patient education, and we reported on this as well. And with patient education, telling patients that opioids can be a problem for themselves or can be diverted to others, and telling patients where they can dispose of opioids and how they should potentially dispose of opioids with FDA criteria, that only gets 20 to 30% of patients to actually dispose of their opioids. And so what we did that was innovative is that we certainly educated patients about it, but then we tried to make it easy for them to dispose of it and tried to help them make it easy to remember to dispose of them. So the first thing we did is we had a drop box installed in our pharmacy, which is in our institution, very close to the surgeon's outpatient offices. So it made it very easy then for patients to drop off their excess opioids in this drop box in the pharmacy. There's no stigma associated with going into a pharmacy and dropping opioids into a drop box, whereas there might be a patient perceived stigma to going into a police station and dropping off opioids, for example. And then we also called the patients a day or two before their outpatient appointment and reminded them to bring in their excess opioid and to dispose of them. And so this was given to them in their initial directions, but it's something that's easy for patients to forget about. We really feel that we were very effective in doing that. And those are interventions, the Dropbox and the phone call are interventions that are easily actionable across the United States.